What is chorionic villous sampling and amniocentesis? Chorionic villous sampling, or CVS, and amniocentesis are two types of tests which are performed during pregnancy to determine whether the baby is affected by a particular genetic condition. The results of these tests provide parents with information about their baby before he or she is born. This information may help parents to make decisions about pregnancy or help them to be better prepared for their child's arrival. Additionally, the information obtained can aid in the care of their baby as treatments for certain genetic conditions can be performed during pregnancy or immediately after birth. Both chorionic villous sampling and amniocentesis are considered invasive tests which involves taking a sample from within the woman's body. A chorionic villous sampling or amniocentesis may be offered to pregnant women if there are unexpected findings in the baby at the time of his ultrasound scan. Examples of this include an abnormally formed heart or brain. A screening test for Down, Edwards and Patau syndrome has been performed, and the results suggest that the baby has a high risk of having these conditions. The pregnant woman has had a previous pregnancy or child with a genetic condition which may affect her current pregnancy. The patient or her partner or one of her family members may have a particular genetic condition which may affect her current pregnancy, such as sickle cell disease, thalassemia major, or cystic fibrosis. Chorionic villous sampling is usually done from weeks 11 to 14 of pregnancy. If the doctor decides that it may not be safe to do the procedure at a particular time, they may offer the patient another appointment 7 to 14 days later when the placenta will be larger and easier to reach. During chorionic villous sampling, a small sample of tissue is obtained from the placenta and sent for genetic testing. The sample contains cells which largely reflect the genetic material found in the baby's cells. Chorionic villous sampling can be performed either by inserting a needle through the skin of the tummy, known as the transabdominal method, or vaginally through the neck of the womb, known as the transcervical method. The transabdominal method is more common because it is often easier to carry out. Transcervical chorionic villous sampling may be preferred to transabdominal chorionic villous sampling if it is easier to reach your placenta this way. During the transabdominal chorionic villous sampling procedure, your abdomen will be cleaned with an antiseptic solution. An injection of local anesthetic may be given to numb a small area of skin. Under the guidance of ultrasound, a fine needle is inserted through your abdomen and into your uterus to obtain the sample. A few samples may be obtained during a single procedure, but this usually involves the insertion of the needle through the skin only once. In the transcervical chorionic villous sampling, a small forceps is inserted through your vagina and cervix, and it is guided towards the placenta using the ultrasound scan. A small sample of placental tissue is then obtained through your cervix. An amniocentesis is a procedure during which a small amount of water around your baby is obtained for genetic testing. It is usually done after 15 weeks of pregnancy. The process of an amniocentesis is similar to that of a transabdominal chorionic villous sampling, except amniotic fluid, instead of tissue from the placenta, is obtained for testing. It will involve the insertion of a small needle through the abdominal wall under ultrasound guidance into the water bag of the baby. A small amount of fluid from around the baby will be removed. This process does not hurt or injure the baby, and the water removed during this procedure will be replenished by him or her. Occasionally, adequate fluid cannot be obtained on the first attempt, and a reinsertion of the needle may be needed. This occurs in about 7% of amniocentesis procedures and is usually due to the position of the baby. The baby's heartbeat will be checked using ultrasound following a chorionic villous sampling or amniocentesis procedure. The doctor may tell the pregnant woman to rest on the day of the test, but she can usually get back to her normal activities the following day. Possible risks of chorionic villus sampling and amniocentesis. Discomfort during chorionic villus sampling or amniocentesis procedure is common and may feel like period cramps. Cramping after the procedure is normal and should resolve after a few hours. Paracetamol is safe in pregnancy and can be taken to relieve this discomfort. Occasionally, the sample obtained from chorionic villus sampling or amniocentesis will be unable to provide a clear result. This occurs in up to 6% of women undergoing the procedure. In this case, the doctor will provide further options. A small amount of vaginal bleeding immediately after a transcervical chorionic villus sampling procedure occurs in about 10% of women. If vaginal bleeding persists or becomes heavy, please seek immediate medical attention. Another important risk associated with invasive procedures is miscarriage. This occurs in 1 in 200 women who have had a chorionic villus sampling or amniocentesis procedure. Most miscarriages happen within 3 days of the procedure, but they can happen up to 2 weeks afterwards. Very rarely, a serious infection can occur following a CVS or amniocentesis. You should seek immediate medical attention if you experience any of the following symptoms: constant or severe abdominal pain, a high temperature of 38 degrees Celsius or more, chills or shivering, heavy vaginal bleeding, discharge or clear fluid from the vagina, uterine contractions. Chorionic villus sampling or amniocentesis can be done for women who are pregnant with twins. Chorionic villus sampling or amniocentesis in twin pregnancies is more complicated and should be performed in a specialist unit. The doctor may need to insert the needle twice to get samples of placenta or fluid from each baby. With chorionic villus sampling, there is a small chance of getting 2 different samples from the same baby, which could give misleading results. The risk of miscarriage when having chorionic villus sampling and amniocentesis with twins is about twice as high as in single pregnancies. If this occurs, it may lead to the miscarriage of both babies. Pregnant women with rhesus-negative blood group should inform their doctors about this. An injection of anti-D immunoglobulin will be given to the pregnant woman after the procedure to prevent her from developing antibodies against her baby's blood cells. For HIV-positive pregnant women or those with hepatitis B or hepatitis C viruses, chorionic villus sampling or amniocentesis might increase the risk of passing the virus on to their babies. They should consult their obstetrician to decide what is best for them and their babies. The results of the tests performed are usually available 2 weeks after the procedure. For women who opted to perform an additional rapid test, this result will be available in about 3 days. Even though the results of the rapid test are very accurate, it is usually advisable to wait for the full report of the chorionic villus sampling or amniocentesis. Doctors will then discuss the results of the tests with their patients to aid them in making decisions about their pregnancy. While the results of invasive tests performed during pregnancy are considered diagnostic, the results from a chorionic villus sampling may report a genetic condition which the baby does not actually have. This is due to a condition called confined placental mosaicism, where the DNA obtained from the placenta do not represent the genetic material of the baby. If placental mosaicism is suspected, further testing options may be considered, such as an amniocentesis. It is important to know that chorionic villous sampling and amniocentesis are methods used to obtain genetic material from the baby and do not describe the genetic test itself. The genetic tests that can be performed range from counting the number of chromosomes, which are large packages of DNA, to look for conditions such as Down syndrome, to tests which look for a specific genetic condition such as thalassemia. Most chorionic villous sampling or amniocentesis results show babies do not have the condition that the test was looking for. Sometimes the result of the CVS or amniocentesis shows that the baby does have the condition that the test was looking for. Very occasionally, the results of the tests indicate that the child may be affected by another condition which was not intended to test for. It is important to note that a normal result obtained from these tests does not mean that the baby will not have any genetic disorders at birth. If the result shows that the baby has the chromosomal or genetic condition being tested for, the doctor will discuss with the patient about what this may mean for her and her baby. Patients may then be referred to specialists like a pediatrician, geneticist, or genetic counselor to provide more information. The decision on whether to continue with a pregnancy is a very personal one. The specialist care team of doctors aim to provide patients with as much information as needed to help them during this time and provide the best care for both baby and mother during pregnancy and after birth. Thank you for watching this video. This video is presented by Yongloo Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.